Welcome to 2025, my friends. A new year and a new wave of psyops to have to grapple with. And the first one that we see getting volleyed into the landscape and getting hammered down hard is that of, once again, another ethereal floating abstraction on the horizon, the threat of another pandemic, possibly having to reorient the factors of how we operate to deal with another cold as we had saw during that of the COVID era. Well, it appears that bird flu H5N1 is very well on the horizon as it is infecting numerous animals in multiple countries and now in multiple states in the United States and spreading to some people. This is actually a conversation that I've had on this channel numerous times. I made numerous videos on this months ago because I realized where this conversation was going to go because it was so clear that this was something that the establishment could use to whip people into a frenzy, just like what we saw during the COVID era, and propagandize them endlessly and in the process get them to go ahead and just extend 1 inch beyond the standards of what it is they would naturally have as their standard order of operations. And in the process of doing so, you would be outside the parameters of what you're used to, and the government would once again shift the goalpost. This is the standards of how these psyops operate. So now let's go ahead, jump in, and see what we've got with people like Dr. Leana Wen. You know who I'm talking about, right? This bitch, the one who openly stated during the height of the COVID hysteria that the unvaccinated should not be allowed to leave their homes. You have the option to not get vaccinated if you want, she said, but then you can't go out in public. As she then also continued to say, we need to use people's freedoms, and I quote, like a carrot on the stick to get them to go ahead and take the vaccine so we can get back to pre-pandemic life, which anyone who understood anything about the societal shift that had happened during the time of the COVID era realized one simple thing about that statement, and that much like what we saw after 9/11, there was no going back to a pre-9/11 time. We were living in a new era, in a new age, and because of this, we had to grapple with what is reality, and that is exactly what someone like Leana Wen does not want the public to do, because in doing so, they would realize the standards that she and her authoritarian ilk were pushing, like what you see here on your screen, was nothing more than felonious nonsense meant to condition and propagandize you to the end of the earth. And propagandize people is exactly what Leana Wen did, as she so consistently went on every single one of the legacy media shows that would have her, and she spewed nothing more than nonsensical dribble into the ether, wrong about quite literally everything. It's quite fascinating to see how this is turned, and in the process, she's now the person that's being brought on the news to speak about the next pandemic, that of bird flu on the horizon. So let's go ahead and throw it into Leana Wen speaking throughout that of the COVID era so you can hear how consistently wrong this woman was, much like every single other person within the establishment was when they were trying to espouse the bullshit that they were trying to sell you surrounding this time. Well, let's go ahead now and let her take it away so she can try and once again propagandize you with nothing more than felonious bullshit.
People are paying a price for the actions of the unvaccinated, because what we know is that the vaccinated are very safe around one another. So the two of you, all of us, if we're vaccinated, we're safe around each other. But if we're vaccinated and we're surrounded by a whole bunch of unvaccinated people, especially in areas with high coronavirus transmission, there's going to be spillover. And that's what we're seeing, that we're seeing vaccinated people also get infections. Now, they tend to not be severe infections, which points to the effectiveness of the vaccine, but it's possible that especially with the Delta variant, we could still get ill, we could pass it on to our family members. And so I think it's really important that vaccinated people stop thinking that we're fully protected. We're very well protected, but as long as there are people, right, I think it depends on the circumstance. So if you're going to the grocery store and the grocery store doesn't have the capacity to enforce some kind of proof of vaccination, then they have to say that indoor masking needs to apply because we don't know who's vaccinated and who's not. The same thing for schools. Schools, you can't expect the teacher in every school to be asking, well, you're not wearing a mask, so are you vaccinated or not? And so if that's the case, everybody should be wearing masks. But I could imagine there are already concert venues or workplaces that are saying, right, if you are not vaccinated, you can't come, or you have to get a negative test. And that's what's needed in order to really incentivize vaccines at this point.
We just saw them
clear to them that the vaccine is the ticket back to pre-pandemic life. And the window to do that is really narrowing. We need to start looking at the choice to remain unvaccinated the same as we look at driving while intoxicated. that you have the option to not get vaccinated if you want, but then you can't go out in public. The honor code was never going to work, that when vaccinated and unvaccinated people are mixing, unless there is proof of vaccination, everybody should still be wearing masks. And so I actually support what the CDC is now doing, which is going back to this indoor mask requirement, because frankly, we know that we can't trust the unvaccinated, that they have been walking around without masks. And in fact, that's what led to the surge that we're seeing.
So, Dr. Nguyen, ivermectin apparently given to deworm animals. Why are people using this? I mean, I know, it's being spread online and stuff, but what is the theory that it works?
Well, I think there are some people who want to believe that there is a magic pill for COVID, which of course we would all want. But this is the main issue. So with ivermectin, not only is it that we know, not only are we saying that there's no evidence it works, it goes beyond that. We actually know that it doesn't work. There was a systematic review looking at 10 randomized controlled trials that have been done, that were done in different countries, looking at different doses of ivermectin. And they found that there was no benefit for ivermectin in reducing mortality, death to COVID-19, no reduction in symptoms or duration of symptoms for COVID-19. So it does not work.
Wrong about essentially everything, and I must admit it's truly remarkable that a woman such as this would be allowed to come back into the public zeitgeist to speak openly and be the mouthpiece for the next wave of propaganda, like she wasn't someone who was just sitting there a couple of years ago openly giving us nonsensical dribble that the establishment was peddling on repeat. The thing is, we gotta go ahead and just break down some of the things that she said because it's so unbelievably infuriating. Starting off with the fact that, well, you see, the vaccinated, they're not safe near the unvaxxed. That's why they need to be locked up and held in confinement within their homes and not allowed to operate within civil society. This in itself is completely removed from what the definition of vaccinated used to mean. Because when you got a vaccine akin to the flu vaccine, you see what that means is you could not get sick or transmit the virus to anyone else. So what does that mean? That, well, this is the same exact narrative that so many were expecting when it came down from the pipe that the government had a vaccine on hand to handle the coronavirus that was ravaging the world. And what we see is they actually ended in the process changing the definition of what it means to be vaccinated, which is quite fascinating because, as we know, we understand that people like Joe Biden, the leader of the free world at the time, if you actually believe that that man was actually the president, realistically, he's nothing more than a corpse getting his marionette strings pulled because he is truly a puppet for the regime if there ever was one. We saw people like Joe Biden, Rachel Maddow, one of the chief propagandists within that of the corporate press, that of Dr. Anthony Fauci and Deborah Birx, the people who were leading the pandemic response team under Donald Trump and Joe Biden, sitting there saying what? That if you got the vaccine, you would be fine. It would be 100% safe and effective, and you could not get sick or transmit the virus to anyone else. Which, of course, this being complete and utter nonsense, as we understand, we realize that seeing the articles that came out over time, you saw nothing more than a trickle downward from that percentage of 100 down lower and lower and lower to the point of the efficacy being near the 20s. That's right. And then you still see people like Dr. Leana coming forward claiming that you need to get updated with your COVID vaccines. Genuinely stunning. The fact is that you're stating that vaccinated people, well, they're not fully protected, you see, and that's why they can't be near the unvaxxed and they need to be locked up, is nothing more than a complete detachment from what the narrative had been sold for so long around so many people's understanding of what it meant to be vaccinated. But they didn't explain any of that. No, they just trudged along and continued to try and propagandize you further. We saw the fact that advocating for mask mandates, which in the end did quite literally effectively nothing, and you can go ahead and read Tom Wynn's book, Diary of a Psychosis, if you would like a proper breakdown of this, or you can go read a litany of articles that talk about how this did not stop anything, and realistically what it did do in some cases is cause cases of pneumonia. And for those that are actually unaware, during the time of the Spanish flu, people were wearing masks. And you know what's so fascinating about that? A large portion of the people that were incredibly sick and dying from the Spanish flu during that time, it was because the masks they were using were so dirty that they were contracting pneumonia, and then when they would get the flu, it would capsize them like the Titanic. But that's not something that's talked about by the health experts of the day that like to bring up the Spanish flu when talking about COVID. No. Why would we ever do that? The fact is that she loves to go on talking about the fact of how that unvax shouldn't be allowed in public, and I know I've mentioned this so many times, but it's just complete nonsense, especially when they use this framing specifically to claim that it's these people, the unvaccinated, that are going out causing this massive surge you see, and that's what's going to be causing people to have to uproot their lives once again and lock down, because there's going to be new waves of this pandemic coming forward, and it's all because of this one group of people, which of course, as we know, was bullshit all along. On to the fact of the last clip that we see, claiming that, well, you see, ivermectin, as Anderson Cooper states, it's an animal dewormer. It's just a horse dewormer, as so many people within the corporate press had stated, which is so unbelievably interesting that that's the mindset that they wanted to tackle this with, and that's the one topic that they actually wanted to talk about, when ivermectin is one of the most used medicines on planet Earth. It has been used billions of times on hundreds of millions of people, but of course, we don't need to talk about that. We just need to focus on the fact of how there's veterinary grade ivermectin, and that's a horse dewormer, and that's what so many people are taking to try and go ahead and fight the coronavirus, because that's what Donald Trump said they need to do. Ridiculous. Also claiming that, well, you see, it would be nice if there was just this magic pill for COVID, but of course, we don't have that, while simultaneously acting like the vaccines are the magic pill that will be consistently taken by the populace to cure them of the ailment that is the coronavirus epidemic. You truly cannot make this shit up. But the thing that I find so staggering about all of this would be how quick of a heel turn Dr. Leana Wen has had. And why might that be? It is only for the fact that the crushing weight of reality that the policies that she and her ilk had advocated for had fallen not only upon her but her child, that she was willing to openly speak out about the fact of how we should have been more measured in our approach during the COVID era. But of course, what we need to realize is, while she may state this because of having hindsight, we now look to the future to understand that she is going to be used as the next propagandistic agent to sell you the standards of the H5N1 bird flu vaccine, because we are now seeing this conversation once again come into the landscape, and she is being the first person to pioneer this conversation alongside people like Dr. Peter Hotez. Much like Icarus, Dr. Leana Wen flew too close to the sun, and sadly in the process, it appears her child is the one that got burned. Here we see from Foundation for Economic Education, CNN medical analyst says masking stunted her toddler's language development and taught her an important lesson about trade-offs. A year ago, Dr. Leana Wen was arguing unvaccinated people shouldn't be allowed to leave their homes, but now she says she's abandoned her extremely cautious COVID views. And they weren't extremely cautious, they were extremely authoritarian and tyrannical, and she will never openly address the fact of what it is that she advocated for that ruined hundreds of millions of people's lives. Now on to the topic of major relevance, that of the conversation that has once again begun to unfold, which is the fact of a new vaccine on the horizon, this time to fight H5N1, the bird flu, which of course, as we know, Dr. Leana Wen is the mouthpiece who is being trotted out on CBS, ABC, CNN, and every single other corporate press outlet under the sun to make sure that she can sell the merits to you about why it is that you need to make sure that you're updated on your bird flu vaccine, just like she did so long throughout the COVID era and was proven wrong at just about every single turn. So now let's go ahead and throw it into one of the regime's favorite medical propagandists, Dr. Leana Wen.
What should be happening in the Biden administration right now that isn't going on?
Yeah, there are two main things that they should be doing in the days that they have left. The first is to get testing out there. I feel like we should have learned our lesson from COVID that just because we aren't testing, it doesn't mean that the virus isn't there. It just means that we aren't looking for it. We should be having rapid tests, home tests available to all farm workers, to their families, for the clinicians taking care of them, so that we aren't waiting for public labs and CDC labs to tell us what's bird flu or not. And the second very important thing is, this is not like the beginning of COVID where we were dealing with a new virus, we didn't have a vaccine. There actually is a vaccine developed already against H5N1. The Biden administration has contracted with manufacturers to make almost 5 million doses of the vaccine. However, they have not asked the FDA to authorize the vaccine. There's research done on it. They could get this authorized now and also get the vaccine out and to farm workers and to vulnerable people. I think that's the right approach, because we don't know what the Trump administration is going to be doing around bird flu. If they have people coming in with anti-vaccine stances, could they hold up vaccine authorization? If they don't want to know how much bird flu is out there, could they withhold testing? I mean, that's a possibility. And I think the Biden administration in their remaining days should get testing and vaccines widely available so that at least it empowers state and local health officials and clinicians to do the right thing for their patients.
Dr. Wen, is bird flu in humans super dangerous?
Well, the World Health Organization estimates that in prior outbreaks of the bird flu, that the mortality rate is 52%. 52%. However, in this most recent outbreak, it seems that most cases have been mild, and maybe some people even have asymptomatic infection. But the question is, we don't know what happens when bird flu affects more vulnerable individuals. People infected so far in the US have been mainly farm workers who are working, presumably generally healthy, as opposed to what happens when you get to children, to pregnant women, to older individuals with chronic illnesses. We don't know how deadly, how dangerous bird flu is going to be for those individuals. And again, that's one more reason why we don't want it to spread and acquire more mutations.
With the prior context of the COVID era, the framing of this conversation truly starts to make a lot more sense based on the emotional rhetoric that is used to try and activate the viewer base of Face the Nation itself, which I must admit is revealing as can be, because in a different age before that of the COVID narrative exploded and completely shifted the dynamic of how people perceived the corporate press, well, what we would have seen this as is two people simply trying to have an open and honest dialogue, trying to get to the root and stem of the conversation to figure out what it is that we can do to save lives from the bird flu. But of course, in this day and age that we live in, people realize that the show that they're watching is free, thus they are the product that is going to be exploited in this exchange. It's truly staggering the way that this is positioned and framed from the guy who is running this show for Face the Nation on CBS, because he says, is it super dangerous? He doesn't ask specific questions about the possibility of certain things coming down the line. He just leaves a blanket statement out there for Leana Wen to walk out on like it's an open stage and goose step around and tap dance to whatever degree and tune and tone that she desires so that she can sell whatever narrative that she is meant to push, because that is exactly what we see she does, as she does nothing more than advocate for vaccines to be peddled endlessly, which gets you hooked on the pharmaceutical treadmill once more, which of course, as we know, is very much the job of people on shows such as this, on outlets such as CBS, that's advertisers, the pharmaceutical industrial complex, would very much like them to get you to acquiesce to. It's truly stunning, especially when you hear them get a little deeper into the conversation, and Leana Wen talks about the prior mortality rate of what had happened with infections with bird flu itself, with an epidemic that had broken out previously, stating that, well, you see, the mortality rate was 52%. And then you take that back to what we saw with the COVID era, and you see what the mortality rate was, which in actuality was less than 1%, which means the standards of what we use to shut down the entire global economic order was nothing more than sold on bullshit, which means we upended billions of people's lives for a lie, in the process destroying over 100,000 small businesses, and that's just in the United States alone. God knows how many small businesses and people's lives were ruined from the rot that was brought upon them from this age. Truly stunning. The fact that I think even more stunning, though, would be the way that Leana Wen talks about what's going on with the current cases you see. Because with the fact of what's going on with the current bird flu cases that have been discovered, well, in fact, they're only in animals or in people that are working in those fields, and they're incredibly mild. And in fact, many of them possibly asymptomatic. So what's that show? That these are the people that we should undoubtedly expect to get something like bird flu. It was predicted months ago. It was fully anticipated years ago with the evolution of this strain and how it was going to develop and what it was going to progress to. But of course, now we have a narrative that we have to sell, and we have another vaccine that we have to push on you. So you're going to have to go ahead and acquiesce to the demands of what it is that we're pushing forward, because you need to be terrified about the ethereal floating abstraction that's around every corner that has a mortality rate of possibly 52%. And I'm not denigrating the fact that these very well may be people that believe the nonsense that they're spewing many of the times, but what I am doing is opening the floor to the conversation that many people need to realize that even if these people in their mind are honest actors, they are being exploited by the people that are pulling their strings, and thus in the end you will be the one that is preyed upon. Truly ridiculous. But not as ridiculous as the fact of why someone like Dr. Leana Wen might be pushing vaccine advocacy in the way that she does. Because we could just go ahead and take this to someone like Steve Kirsch on Twitter, and here we see, did you know Leana Wen made over $500,000 from Big Pharma in 2021? No wonder she is so pro-vax. Interesting. And I'm not here to hate on vaccines. I don't have an issue with them. That's not my problem. I don't like the childhood vaccine schedule as it's set up. It's absolutely absurd that we're bombarding children with 72 vaccines, smearing their eyes with erythromycin, as well as giving them an HPV vaccine and something to handle Hep B. Are you kidding me? Anyone that understands anything about medical science at the most rudimentary level, and I mean base level, being a moron like myself, realizes that a Hep B vaccine is only needed if the child is nicked by something that contains the virus itself, thus it gets into the bloodstream, or it is through sexual contact. So, why is that this is happening, being bombarded upon the children of the United States? Well, it's because it's very, very profitable. That's why, and that is exactly why the vaccine schedule has evolved the way it has. And again, I say this as someone who does not have an issue with the idea of vaccines. They are a marvelous technology that has done great things and saved many lives. But it comes down to the fact of the implementation and how it is that they are used and how it is that they are pushed. That is one of the crucial things to focus on. And just to end this off, to focus on something that I think, well, we should all be a bit weary of, would be what comes over the horizon, because my goodness, my friends, it would appear that face mask mandates are returning in multiple states in the United States as doctors are warning of a quademic of 4 viral infections. Isn't that something? And you can just take this back to the clip of someone like Dr. Peter Hotez speaking previously about how after the Trump administration gets into power on the 20th, there's going to be this explosion of viral epidemics that are breaking out that we're going to have to tackle. Who knows what's going on with that conversation? You go ahead and ruminate on that thought on your own. I'm going to go ahead and call it here. Thank you for watching. If you got this far, thumbs up if you liked it, thumbs down if you didn't. Tell me where I'm wrong in the comment section down below. Stay lovely, stay great, and please, my friends, go tell someone you love them. Happy New Year. Peace out.